Okay, guys, before we begin, as you know, me and Anna had our fertility MOT where we learn all about our eggs and how many eggs we have and where we stand with our fertility right now. So guys, London Women's Clinic are offering our listeners, if you if you mention Sisters in the City, you can get your fertility MOT for $450, which is a majorly discounted price.
Yeah.
Okay.
That's amazing. I'm so happy to be able to offer this to people.
So make sure you book your fertility MOT and get it checked.
Hi guys, welcome to Sisters in the City with me, Anna Vakili.
And me, Mandy Vakili. So guys, you know, we have like an egg obsession. We are very, dedicated to learning more about women's fertility. And that is why we have a very special guest today.
Yes,
and so don't get this wrong. We have Dr. Vanessa Ross. Woo! And she is a reproductive medicine specialist from Australia. She is currently visiting London Women's Clinic. Guys, that's where me and Anna got our MOT, our eggs. Was it? Our fertility MOT. We got our eggs checked. And London Women's Clinic is a leading fertility clinic that pioneered many of the routine techniques that are used today.
Yeah, so after we went and got our fertility MOT, we had so many questions, yet because we're not professionals on it, I feel like we weren't able to give the correct information for people, and we didn't want to give misleading information. So that's why we thought it'd be amazing if we had you here. So thank you for joining us.
Thank you so much for having me. It's so exciting to be here and to be on this podcast and that opportunity to have a chat about, female fertility and women's health. I think that's really fabulous. So
That's great to have a woman as well.
Yeah.
A woman, a female doctor here. She knows the struggle.
Exactly. And I feel like we don't get taught these things like in school. It's just not part of the educational process.
No.
You know what I mean?
Nothing.
And it's so important. I didn't know anything about it until now. I'm 34. I'm like, I wish I did it sooner.
Yeah.
So if the podcast can do one thing and like just educate our listeners. Yeah, we're all fun and games and we're mostly comedic, but we do like a little bit of.
I literally thought that like eggs were like created brand new in your body every month, and then they like recreated every month, and then they come out in your period. I had no idea until I had my fertility MOT. I had no idea. But we've got loads of questions.
Yeah. So one of the questions that we've got for you is, as women, we hear so much about our biological clock, but what are the most important things for our listeners to know about age and fertility?
Yes. Absolutely. And that's probably one of the most common things we're faced with as fertility specialists. It's that age-related fertility problem. And I think the important thing to know, and, you alluded to it already, that, we don't really get taught this stuff. A lot of people will say to me, I just wish that someone had talked to me about this at school. I had no idea. I knew all about how to avoid pregnancy, but I never knew what my fertility was further on. And so, it's so important to really know how aging works. And really what normally happens is that you're born with your lifetime supply of eggs. You don't make more. And you actually had your highest number of eggs when you were about halfway through your own pregnancy in your mum's womb. So that's when you had millions of eggs in your ovaries. And even by the time you were born, that was probably down to about 1 million. So there is just this constant loss.
So you're losing eggs before you're even born.
Exactly.
Basically, I had a baby when I was a baby in my mum's belly.
You're losing eggs before you're even born. And that's the really tricky thing. And even in those years when you're a young girl, you haven't gone through puberty yet, you're still getting that loss of eggs. So those 1 million eggs that you were born with is now, by the time you get your first period, about 300,000 to 400,000. So there's been that continuous loss in that time. And so it's really important to then understand, how the ovary ages, I guess, over time and what happens. And it's don't cry, Mandy. It's fine. It's okay. But, I think that it's important to understand how our bodies work. And so after puberty, what happens is that every month, if we've got regular cycles, we pull some eggs out of storage. So we've got our eggs sitting there in storage and we pull some of those eggs out of storage. And then what happens is that one of those eggs is chosen to mature and to grow. And that's the egg that then ovulates and has a chance of a pregnancy. So that's sort of how it works. But the really hard part about that is it's not just that one egg that you lose every month. It's actually that whole group of eggs that they sort of pulled out of storage, going, pick me, and then one egg is selected, but all of those eggs are actually lost that month. And so it's really important to understand how that loss happens. And as you get older, the other thing that happens is the egg quality changes. And so that's an important thing for women to know about as well. And so when we're thinking about egg quality, we're saying, well, it's about the eggs and how likely they are to make genetic mistakes. So you've probably heard that as women get older, they have higher chances of conditions like Down syndrome, for example, and that is directly related to age. So this is where egg quality is important, because you're basically, the eggs, as they divide their genetic material to pass to a potential pregnancy, they make more mistakes. So the little embryo early pregnancy then has either too much or too little genetic information. And therefore, you either can have conditions like Down syndrome, or you have conditions that result in pregnancy losses or miscarriage. And so that's why it becomes harder and harder as women get older.
Mm-hmm.
Really,
would you say there's an
that.
average age as where it really drops to like a dangerous level of mistakes?
Sort of the stages, like what are the chances of conceiving and...
And because of all of those things, it's really directly age related. So we often refer to this number of 35. That's when that decline in both numbers and in egg quality happens a little bit faster. Okay. And so we find that women, when they're over the age of 35, it does get a little bit harder to get pregnant, and it does mean that we do see more women coming through for fertility treatments and things like that than we would if they were younger, because the egg quality is a lot better.
Yeah.
And this is why it's so important to know all these things, because for example, I'm 34 now and I'm only learning these things now, and it's like suddenly this pressure on me that, oh my God, I need to get cracking in the next year or so. But if I knew this 10 years ago, then I would have known that, okay, by 34, I should really be, ready.
Yeah.
Whereas
you would have lived your life completely different, because you would have known that you should be like trying for, like, you wouldn't be wasting time with idiots because you'd know, like, bitch, running out of time. I am literally losing eggs as we speak. I'm on my period. Like, my whole reserve storage is in my tampon right now. Like, it's really hard times. So basically, after the age of 35, it declines more rapidly.
Correct. So
why is women suffering this and men just,
get to ride out till...
Tell me their quality. Tell me something about sperm quality.
It does. And male fertility is just as important. And that, for years, it's been this really big focus on women and fertility. And you're right, there's kind of this dark cloud over you when you're in your 30s. But it's actually just as important, male fertility, as you get older. And I mean, the sad thing is women will get to a point where they can't have babies anymore with their own eggs. They'll go through menopause, and on average, that's around 50 years of age. Whereas men can have babies later in life.
So their quality stays the same?
Well, it's not their quality. So men, the difference is that they make new sperm every few months, whereas women are born with their egg supply that's going to last them for their life. So, as the eggs are sitting there, they get older and they make those mistakes we spoke about, whereas men can make new sperm. But that being said, we do see as men get older, particularly once they're over the age of, say, 45, that their sperm quality does decline. And so, we do see associations with other health conditions that are associated with the actual male being older, in the same way that we see things with the woman being older.
This is good ammo for us to use against our partners. This is good ammunition for me to use against Gingerbeard, about his fertility. I'm going to exaggerate a little bit. All right, we have the second question we have is, what are the common reasons why women are freezing their eggs, and what does this process involve? Because I've heard some horror stories about it making you fat, hormonal. I'm already fat and hormonal. I need to know, what does it involve? And yes, what are the common reasons?
So I think the common reasons that we would see women to freeze their eggs is I think there's a lot more awareness now about that concept of, eggs aging and your egg quality getting worse, I guess, as you get older. So I think we see a lot of women because they are perhaps in their 30s and they're saying, look, I'm not in a position to have a baby for one reason or another, whether it be I haven't met the right partner, I am with a partner, but we're just not ready. We're not in that space of the relationship yet. Or I've got this career path that I'm working towards, and they're probably, common things that we would see. And there's also women who would just come in and say, look, I'm really unsure about my wishes to have a child in the future. And so, what are my options? What should I be thinking about? And so it's varied, I guess, why women would come in. And then there's also a whole other spectrum with egg freezing, which is related to medical egg freezing. So when we're talking about other things, it's more the elective, social kind of egg freezing, whereas there are some women who are going to have conditions that can affect their fertility later on. And probably the most common thing that we see is people being diagnosed with cancers, and cancer treatments are very toxic to the ovaries. And so having a condition that could put you at risk of your, eggs being damaged or the count running out or whatever it might be, are reasons to do egg freezing from a medical perspective. So we do see a lot of that as well.
But you can't depend on egg freezing, can you? Because I've heard that the success rate of egg freezing isn't that much.
Me too. I've heard people have done it and then none of their eggs survived or something. Is that the term? So
I really want to know more about egg freezing myself, because obviously, we went for our fertility MOT. We've got our results, which we're going to discuss in the end.
Yeah, sure.
But I think the next option for me would be egg freezing. But I'm just trying to think, is it worth it for me to do? Is it worth me spending that money? Would that,
Do you know what I also think, Dr. Vanessa? I also think, if I do the egg freezing, you're taking my stored eggs, the ones that are they might make it to be the one, that gets the chosen one. So you take those, and let's say I do 2 cycles. You take both 2 lumps of my eggs, and then let's say they don't make it, and you took them from my body, and they might have had a chance in my body.
And this is a really common thing. So no, it's not. So I think for both of those points, I probably have some reassuring news for both of you, because I guess from an egg freezing success point of view, egg freezing has come a long way in the last sort of, 12 to 15 years. It was really only about 12 years ago that it became not experimental. It used to be that it was considered more experimental, and that's why it was really used for women who had those medical risks that we spoke about. And so more recently, the technology has just come such a long way in that short period of time. The way we freeze eggs has changed, and it's so much better now in the way that, we can then get these eggs that have been frozen and we warm them or thaw them, and we're seeing survival rates of about 94%. So the most exciting thing I think about sort of egg freezing in recent times is actually we've now done some really big studies, some really great studies that look at how the eggs perform compared to women coming through at the same age who are having IVF cycles to get pregnant using fresh eggs rather than frozen eggs. And they're the same. So this is actually a huge study that the London Women's Clinic has recently published this year in one of the big peer-reviewed journals. And it's a really, really exciting thing for egg freezing, because it's showing that the eggs are performing the same as fresh eggs at the same age. And so the most critical point is really the age that you freeze your eggs. And that then means, what fertility potential you have with those eggs. And so that's something that's a very individualised discussion. When you come in for your MOT, that's something that we cover with you, and we talk about your, particular goals and your results and what that means moving forward. And so I think that it's fair to say now that whilst, not that long ago, egg freezing was experimental, it's not that way anymore. It's actually a really good thing to preserve fertility.
So do you think they've got more of a chance when they're taken, extracted and frozen than they would have in an older woman's body, like a 35 plus year?
So it basically is dependent on the egg age. So if you freeze eggs at 30...
I'm 34. Let's say I freeze my eggs now, at the age of 34. Do you think that I have a better chance of conceiving when I'm 38 with the eggs that I frozen when I was 34 or just naturally conceiving at 38?
Absolutely. So with the eggs that you froze, because
Really?
it's all related to egg age, because the 34-year-old eggs are going to be less likely to have those genetic mistakes. And so that egg quality that we were talking about earlier is much better in a 34-year-old egg compared to a 38-year-old egg.
Yeah.
But not just the quality, but just the fact of actually getting it and making a baby out of it. Is that more of a chance?
Yes.
Oh, there is.
Yes.
Yeah.
So why freeze my eggs? I'm freezing them with London Women's Clinic. I've decided, and I'm freezing my eggs. I've decided, but I've got another question about this egg freezing. So, like when the egg has matured and it's working, the frozen egg is working. You put the egg inside, like Anna's body, yeah, and like, is there another phase of like, is it going to survive at that stage as well?
Yeah, so there's a few steps that happen after you've frozen eggs. So say you come through for a egg freezing cycle, and we can talk about that if you want, what that sort of involves. But basically, if you have frozen eggs and you say, right, I'm ready to come back and use my eggs, and it might have been that you've been trying naturally and it hasn't worked, or you've tried some other fertility treatment, and you say, you know what, I'm 38, I want to use my 34-year-old eggs because they've got a better fertility potential. And so what we would do is we would warm the eggs, and so we thaw them, and then we have to inseminate them with sperm. So basically to do that, we have to inject the eggs with the sperm.
Outside of the body?
Correct.
Okay.
So this is all outside of the body in the laboratory. So they will inject the egg with sperm, and that's called ICSI, or intracytoplasmic sperm injection. So that's that classic photo you guys have probably seen in the media, with the sperm being injected into the egg. And so we would fertilise those eggs. So even when you put the sperm and egg together, though, that doesn't guarantee that the egg will fertilise. But on average, about if we say started with 10 eggs, we would usually get about 1 to 2 what are called embryos. And embryos are early pregnancies. So they're when an egg and a sperm have fertilised and they've divided their cells, and they get to a point where they have about 100 cells, and that's called a blastocyst. And that takes 5 days. And then if we have a blastocyst, we can then do a very sort of straightforward, easy procedure to put that embryo back in the womb. So it's a very carefully timed cycle, but it's not as intensive as the cycle you would have to freeze the eggs. But we basically would put that embryo back, and depending on your age that those eggs were when they were frozen, that would then, obviously determine your likelihood of pregnancy. So if you, for example, did this at 34 and you came back at 38, that embryo is made with 34-year-old eggs. So it has the potential of a 34-year-old embryo. So, each time we put a 34-year-old embryo in your womb and it's a good quality embryo, then we would have about a 40% chance of pregnancy.
So that's 40% chance.
Exactly. So, but it's different if you're older.
Okay.
And the process of actually getting your eggs frozen, because I think a lot of people are interested in that as well, like what that process involves, like how do you start it?
Yeah.
Like getting your eggs taken.
Yeah. And that's a really good question. And I mean, you guys have already started part of that process because you've been to London Women's Clinic, you've had your fertility MOT, and that's usually the first step, is that you need to come and speak to a fertility specialist, talk about your goals, talk about your general health, and then you'll be sent for other tests. And so it would usually take about a week or two to sort of get everything worked up for you to then undergo the treatment. So you do need to then, after your appointment, go and have some blood tests. And then you would also meet with our nurses, because you need to learn how to take injections. So essentially, when you have a natural menstrual cycle, your body releases a hormone called follicle stimulating hormone, or FSH. And that's the hormone that encourages that one follicle to mature an egg that we spoke about before that would then ovulate. And so to use treatments to stimulate ovaries, basically what we need to do is we don't want just one egg from that cycle. We want all those little eggs that have been recruited that month on the ovaries. So when we do an ultrasound, we can see these little follicles on the ovaries, and we want to encourage all of them to grow, because we're going to, if we didn't, we're going to lose them anyway. And this comes back to your point earlier, Mandy, is that, those eggs would have been lost that month. We're not pulling those eggs out of storage.
So they would have been lost that month.
Exactly.
Yeah, so we're making the most out of the eggs you would have lost.
You would have lost them anyway. And that's a really common question. We think, a lot of women say to me, oh my gosh, I've got this limited pool of eggs in storage and I'm taking some out because I'm trying to freeze more than the one I would have ovulated that month. And that's just not the case, which is a really reassuring thing. So we're sort of, I guess, encouraging more than one egg to grow with the follicle stimulating hormone. So we have a medication that we can use that mimics that hormone, and it's an injected medication that you take over the course of about 8 to 10 days. So you have to see the nurse to learn how to take that medication. And then essentially we would start a cycle with your period. So when you've gone through all the different steps and you're ready to start your egg freezing cycle, you would call us when you start your period and we would get you in for a scan and we'd look at the little follicles on the ovaries and say, right, this looks good. We've got a good number of little follicles there. And then we would start the medication. And so over the course of about sort of 2 weeks, we would be on some medication to grow the follicles. And then we would give you eventually another medication to stop you ovulating because we want the eggs.
Yeah. Is there anything we need to know about the medication? Does it have a hormone? Does it change your hormones or?
So it is a hormone and it is going to produce much more, hormone in the body than what you would normally be having in a normal month, because your follicles on your ovaries do produce hormones every month. And so you produce estrogen and progesterone, and they're hormones that are really important for general health and mental health and heart health and bone health and those things. But for us in an IVF cycle, we're encouraging more follicles to grow. So you can imagine that the hormone levels are probably about 10 times what they normally would be.
But at least it's a short process. It doesn't sound like a long process.
No,
it sounds
it's actually, a reasonably short process. But in that time, commonly women will say to me, oh, I just feel a bit tired.
Yeah.
I've got a bit of a headache, but they go about their normal life. It's not as disruptive as a lot of people worry it would be.
That's good to know.
The only thing is that when we get to the point where we go, right, these ovaries look like they've grown some follicles, we look like we're at a point where if we drain those follicles that we're going to get some mature eggs to freeze. And so once we get to that point, you would be triggered. So we trigger that final maturation of the eggs inside the follicles, and then we would take you for a little day procedure. So you have some very light sedation. And we drain those follicles under ultrasound guidance, essentially. And so we've got embryologists in the operating theatre with us, and we take that follicular fluid, we give it to the embryologist, and they look under the microscope and they find the eggs, and then they freeze them.
Wow. And then they freeze them.
So that's sort of in a nutshell. That's a very rough sort of way of talking about it.
It's good to know the process, though. Yeah. It's good to know that it's actually quite short. I'm willing to go through anything. I'm willing to go through tiredness. I'm tired anyway.
Yeah.
I'm willing to go through all. I want to freeze my egg.
It's definitely something that I'm going to look into doing, and I'll definitely, most probably with London Women's Clinic as well. So there's obviously a lot of information about fertility out there, but I wanted to know whether you can tell us about common myths, and is there anything that we need to know? What's true? What's not true?
Yeah.
So I think there's lots of myths out there, as I'm sure you can imagine. There's so much information. And I think in the era of social media and blogs and everything else, there's just so much out there. And so it's really, really hard to sort of work through and find what's reliable, what's less reliable, what's factual. And that's why I think it's really important when you are looking at your fertility and thinking about your options that you do come and have a fertility MOT with a fertility specialist so you can talk through that more specifically. Because I think some of the myths that we would commonly encounter are often related to things like some of the testing you might do for fertility. And particularly one test that we do is called an AMH test or an anti-Mullerian hormone test.
Yeah.
And essentially that's a test where that's, I guess, giving us a bit of information about how many eggs you have in storage. So those eggs that are sitting there resting on the ovaries, they're secreting this AMH hormone. And so we can do a blood test and check the level, and that correlates quite well with your ovarian reserve. Okay. And so the common myth I think I see about that is I see a lot of panicked women who come in and say, my AMH is low for my age. Oh my gosh, I'm going to be infertile. I'm going to need IVF. It's all doom and gloom. And that's just not true.
Mine was 2.3, which the professor told me was lower than an average woman my age.
Mine was lower than the average woman my age.
And I did have a panic as well with that, because I was like, oh my God, I mean, I don't even know anything about this hormone, at all. Like, it was the first time I'd probably heard of it.
But you don't think it's all doom and gloom then?
No, I think, the important thing to know is that AMH does not determine natural fertility. So that's the one thing people think, I can't fall pregnant naturally. And it basically, if you have a low AMH and another person your age has a normal AMH or a high AMH, you still both have the same chance of falling pregnant naturally, because in a natural cycle, you're still releasing one egg. It doesn't matter how many eggs you have in storage. And so even if you have a low AMH, that wouldn't be a reason to say you need to go and have IVF or fertility treatments. It would be still very reasonable if you said, look, I'm ready to start trying for a baby. It would be very reasonable to still have a trial of natural fertility, as you would for someone else your age. And that's, I think, one of the most important myths. What it does tell us is more about what to expect your ovaries to do in an ovarian stimulation cycle. So that's for egg freezing or for IVF. That ovarian stimulation cycle, it's the same. And so it might be that we would say to you, look, your AMH is a little bit low for your age. So we would not expect your ovaries to give us as many eggs in one cycle as someone else who has a higher AMH for the same age.
That's what the professor told me.
Our eggs aren't enthusiastic.
Yeah. The professor told me that from one cycle, we probably won't get enough eggs to freeze. So he said you probably need 2 cycles.
How many eggs do you think is ideal to get from an egg freezing?
And that again depends on your age, to be honest. So that recommendation does change a little bit depending on your age and your fertility goals as well. It's very different. Someone who says, I'm 34, but I want 1 to 2 kids. Oh no, I'm 34, but I want 6 children. And so on average, we would really say that you should probably be thinking, if you're under the age of 35, it's reasonable to freeze about 10 to 15 eggs. And it may be in your case, we don't get 10 to 15 eggs in one cycle. So you might be someone who does need to think about doing more than one cycle to get the same number of eggs stored.
Which is more money, because each cycle costs money, isn't it?
I'm doing this. I'm selling my soul.
It does.
Please subscribe to Patreon. I need money to freeze my eggs.
But I mean, the good news is, there are options, and the London Women's Clinic knows how expensive, obviously, fertility treatments of all types can be. So there are options, and you can speak to people about what those options are, and payment plans and other things like that.
Oh, amazing.
So there are things that you can do to make it more affordable, because it is really hard, when, if you're having fertility treatment for one reason or another and things are more expensive, it's good to know that there are some options financially.
That's so
as well.
good to know
100%.
that there's payment plans. That's great.
Before we go on to my next question is actually my favourite one. It's the one I'm most interested in. But before that, because we're on myths, I want to quickly ask you. I know someone who's basically just fallen pregnant again, but it's her second child. She's fallen pregnant at the same exact time she's fallen pregnant her first child.
Right.
And her due date is her first child's birthday, basically. So is it a myth, or are women more fertile at some points of the month or the year? Is that true or not? Or is it just random?
It's probably random.
Okay.
Like, they do think, sometimes in the warmer weather and all these things, but there's nothing
Or certain
really.
positions.
We're nothing,
Certain positions?
No,
Missionary?
no, sadly, no tips in that regard. But, I think that it's probably just random.
Just random.
Yeah.
Okay.
Yeah.
Good to know.
Yeah.
Okay, so the next question is, because obviously I'm very unhealthy, I need to know this. How important is diet, stress, and exercise when you're trying to conceive?
It's a good question. I mean, it is really important to be as healthy as possible. So if you're planning a pregnancy, it's really important that you're thinking about any lifestyle things that you can improve, because, there's so many things we can't change. We can't change how old we are. We can't change our genetics. We can't change our family history. But the one thing we can control is things to do with lifestyle. And really lifestyle things do have a really good influence on fertility outcomes. So, for example, things like diet. So that's the first thing a lot of people want to know about and want to ask about. And so we give people information about how, they should manage their diet, whether they're going through treatment or they're just trying to conceive. And one of the biggest tips, I guess, is there's a lot of data now about the Mediterranean diet.
It's the best.
And that's being effective from a fertility point of view. So we do encourage people to be, looking into the Mediterranean diet and really, having lots of green leafy vegetables and fish and omega-3. And it's something that can actually improve outcomes, which is really, really good. I think the biggest thing from a lifestyle perspective is really other things like smoking. Smoking we know is really bad for both eggs and particularly sperm. And, it's really important that if you are planning a pregnancy that you wouldn't be smoking. From a sort of alcohol point of view as well. So women, obviously there's no safe limit in pregnancy. So if you think you could be pregnant, you wouldn't be drinking at all. And even through fertility treatments, we encourage you to really reduce alcohol intake. Men particularly can see an improvement if they're very heavy drinkers, then they'll see an improvement usually in their sperm if they do cut back and ideally, really reduce their alcohol intake. So these are things that can make a meaningful difference.
What about stress? Does stress affect fertility?
So there's been a lot of studies into stress and fertility, and I guess that's probably one of the more controversial areas. So there are no really sort of, big studies that have said that stress definitely influences fertility outcomes. There have been some studies which show maybe a little bit of a trend, but generally we don't have any hard evidence to say, look, you've got to cut out all the stress from your life, and that's just not realistic either.
It's hard to measure stress.
It's really hard. And, everyone has different, commitments, work, podcasts, all these other things that are quite stressful. And so, I think it's just important where you can to not take on extra things. I always say to people trying to conceive or if they're in treatment cycles, be a bit selfish, be really kind to yourself. Try not to do things that you don't have to do because, it's not the time to volunteer to throw like a big Christmas party or whatever. Yeah. Leave that to someone else. You've just got to kind of have some downtime, have a really good balance. And that also comes to things like exercise. We really encourage people trying to conceive or whether they're going through egg freezing or whatever it might be, how important it is to exercise. And so, we say 30 minutes of moderate exercise, maybe 5 times a week, is really, really effective.
I was so worried about me and Mandy's fertility MOT because we're like the opposite of all that. Yeah. So we do not exercise. We don't have a healthy diet. We binge eat.
And we stress.
And
my situation,
we don't smoke. That's one good thing. We don't smoke.
Sometimes I have a fag in there, very social, like when I'm drinking.
We binge drink as well on the weekends. When it's terrible.
Mate, I don't know. My partner is a heavy drinker, heavy smoker. I know, come on.
Yeah.
Every 20 minutes smoking, drinks like so much.
It's not good.
It's really bad. So I'm going to blame it on him if we have any problems.
In a way, when I went for my fertility MOT, even though I was upset because of my lower AMH level and my eggs were lower than normal, I was actually a little bit grateful at the same time because I was like, I'm grateful that I actually have eggs there and they're healthy. Like I have to look on the bright side. Like I haven't had the most healthiest lifestyle.
Yeah.
So I was kind of in a way grateful as well.
Me too. Speaking of ginger beers, being a heavy drinker and a heavy smoker, I do want to know more about male infertility. Yeah, we need to balance out the scales now. What's important to know about the current trends of male fertility and how this can be improved?
I think that's a great question because I think for so long the focus has really been on female fertility. Women. We talk about that, biological clock and, it really is something that we're seeing actually also applies to men. And it's something that we've been studying a lot more recently. And even in the last sort of year or so, there's been some really big studies done that are looking at sperm across the world. And what we've seen is that sperm count and concentration is actually declining worldwide. Why? So, and that's the great question. We're not really sure. So they're looking into really why that is. But I think it's really important now to highlight male fertility and to say, yes, we talk a lot about female fertility and thinking about your fertility, particularly as you get older and being proactive about fertility options. But male fertility is also something that we need to be thinking of. And so it's still reasonable for men to come and have a fertility MOT, even if they might not be ready to be thinking about a family just yet, if they just want to discuss their options or have their, assessments done as well.
So men can come for fertility MOTs as well?
They can, yeah.
Do you know what? If that's such a good point, because my mum's ex-husband, he couldn't have children, but he didn't know.
Right.
And he thought it was my mum. And he kept putting her through all these treatments, all these hormonal treatments for years, trying to get her pregnant. And then in the end, they were like, she can't get pregnant. And then he left her for another woman.
Yeah.
And then guess what? It was him the whole time.
Because he still can't.
He still can't.
Yeah.
So he should have gone for a fertility MOT.
He should have. I mean, and that's a really common thing that we have seen as well. It's a lot of the time, perhaps the male partner won't even come in for an assessment until we've looked at everything from a female perspective. And when you think of the causes of fertility problems, 1 in 6 couples will need fertility assistance. It's really, really common, 1 in 6. And so when we think about, well, what are the causes? Yes, 30% of the time it is just the female. And there might be a medical condition like their tubes are blocked or they've got endometriosis or they're not ovulating. But 30% of the time it's the male. So there's an issue with the sperm. That's a good question. So there's a combination of both.
You and your good questions, man.
Right. So you can have, combined fertility issues. There might be something going on from the female side and there might be something going on from the male side, and they're both contributing to having issues falling pregnant. And then there's a group that we call unexplained. So we do all the conventional kind of fertility tests and there's no obvious reason. And that's quite a difficult, group of people to deal with because we can't give them answers.
Oh my God, now you're saying that. I just met up with one of my friends recently and she said to me she's been trying to get pregnant for a year. She's been to get checked. They said there's nothing wrong with her at all. Her eggs are fine. Everything's fine.
Must be him.
Everything's fine and she can't get pregnant.
Maybe it's him.
Well, I didn't ask about that.
Maybe he's like, how do you know if the guy's like ejaculating semen, does that mean there's sperm in there?
No.
Does that mean?
It can be a sperm problem. And so, when couples have been trying and they're not getting pregnant, it's important that they do have a fertility MOT. And particularly if they're they're people who have other medical problems, if they've got known endometriosis or they know they don't have a regular period and they don't ovulate every month, or if there's medication that they take, it's really, really important even for those people who might be just thinking about conceiving and wanting to assess their fertility. You can do that. You can have pre-pregnancy counselling and assessments, and often you might pick up something that could influence fertility, and they might have gone off for a couple of years trying and perhaps not had success. So it's important to be proactive about it.
There's just so much to learn, isn't there?
There's a lot.
Do you have any more myths to tell us about fertility?
I think there's probably some common myths that I would be asked about. I guess one thing that we commonly get asked is, we have women thinking about freezing their eggs. They're not in a position where they're ready to have a baby.
Okay.
And they might be in a relationship and they say, okay, well, I've got my partner here. I've heard that freezing embryos is much more successful than freezing eggs. And it used to be that was the case. It used to be a while ago when the technology with egg freezing wasn't advanced as embryo freezing, that people found that embryos survived that freezing and thawing process better.
Hold on a minute. You can freeze an embryo?
Yeah.
That's wow.
It's very common.
I didn't know that.
That's like freezing a baby.
That's a very normal part of IVF. And so for IVF treatment, what we normally do is we're doing the same thing we do in an egg freezing cycle. So we're trying to create more eggs than you would in a normal month. And then what we do is we fertilise those eggs. So we inseminate them with sperm. And there's 2 ways, one being the ICSI that we spoke about before. And that's really if there's sperm that has issues like problems with its count or the shape is abnormal or the way it moves. But the traditional IVF kind of test tube sort of technique is really where you put one egg in a dish with about 100,000 sperm, and you leave it overnight, and a sperm has to fertilize the egg. So when you do that, you create embryos or early pregnancies. And so what you will see is that after 5 days, on average, for every 10 eggs, we might get 1 to 2 little embryos. And so if someone's actively trying to get pregnant at that point, we would put one back on that 5th day after the egg collection, and any other embryos would be frozen. So if that first embryo doesn't work,
I'm learning so
I've always wondered what happens to the other
a
little
cycle to basically
babies.
put that little embryo back in the womb. So
but so now you know that egg freezing is more successful.
Well, it's not that it's
just
more
as
successful, but it's very, very good now. So it is something that's a reliable, I guess, option for women. And particularly if you're not at that stage in life where you were thinking of actively trying. I guess the difficulty with making embryos with someone is that they belong to both of you.
Right.
So if you break up, it could be that person might say, well, you can't use those embryos. And even if they're all you have, you can't use them.
Oh, no.
So if you're married and let's say you're married but you're just not ready for a child yet, but you're married without your partner and you both want a child later, it's probably a better option then to freeze your embryo with him than freezing your eggs?
It depends. You can, absolutely.
What if he turns out to be some...
Because let's just say that you're not planning on getting in a divorce, Mandy, and you want to be with him. You're better off just freezing your embryo than going through the whole egg freezing process, no?
I guess it depends. It's sort of like you're further down the line. You've got more information because when you're at the stage where you have eggs, not all of them will fertilize, not all of them will become those embryos. And so when you create embryos, you're sort of further down that path. So you know that selection has already happened and you know how many embryos you have. But I think it's still really, something that we talk about. We would say to a couple, look, you can freeze eggs, you can freeze embryos. And historically, it might have been we'd say, look, freeze embryos because the technology's better. But that messaging isn't necessarily the same now. And so we would sort of say, look, it depends on your circumstances. So particularly if one of the, one of the members in the couple are not quite sure yet about their plans for having a baby, then we'd probably say, look, maybe freeze eggs. But if you're both really wanting a child and you're just wanting to preserve your fertility at a younger age, absolutely, it's an option.
Yeah, okay, that's so interesting.
Last question.
So we don't learn about fertility and IVF much at school. What education is there around fertility and fertility treatments? Is there anywhere people can go and learn about it? Obviously, we've put it on our podcast, but it's interesting.
It's very educational, our podcast now.
It's great. I think it's great that you're having that conversation, and that's really what it's about is bringing attention to it. I think young women need to be proactive about their fertility. And as we spoke about, men do as well. It needs to be something that they're thinking about because if we, are older when we're trying to have a pregnancy, even with things like IVF, it may not be successful. And I think a lot of people really rely on IVF as being a safety net. And that's just not the case, particularly with women who might be in their late 30s or 40s. It can be even very tricky to fall pregnant with IVF. And so I think it's important to have information about what your options are. And it's hard to find reliable sources. There's too much out there, really. And it's hard to know where's the best places to look. And so I think it's good to really, if it's something that your listeners are interested in, is that they should book a fertility MOT. And they should have an individual assessment where they can discuss their goals and, we can explain exactly what their options are. And realistically, there are other sort of ways to get information that's reliable. And so at the London Women's Clinic, we have a lot of, webinars and educational sessions. So listeners can also keep an eye out on our website for those things. But we've got a couple of events coming up. So next month is PCOS Awareness Week. So polycystic ovarian syndrome, I'm not sure if you guys have heard of that. But that's a condition that affects a lot of women. And so we're doing an information session session about that, how it might affect their fertility. So it's going to be a webinar. So we've got all the information on our website. So if people are interested, they can just register to attend that. And then other things, if couples are trying to conceive and they're having difficulty and they want to explore their options, we do have another seminar, I believe, coming out in October, which is about couples wanting to pursue IVF treatment. They can have, access to lower cost models, particularly if they're on waiting list for NHS or they're not eligible for NHS. It is a pathway for them to perhaps access IVF treatment earlier rather than having to wait. So
that's amazing.
It's something that, it's also
so guys,
there.
you need to keep an eye out on the London Women's Clinic website, definitely, because I want to know all about these webinars and these, events.
And if you are interested in going for a fertility MOT, we have done a vlog, but it's pretty straightforward. Me and Mandy came to the clinic.
It was very easy.
We had a quick chat with the professor, and then we went into the room, and it's almost like, how can I explain it? When you see the movies and you go for to check ultrasound, when you check the belly, so there's this rod, they put it in and it's like a black and white screen, and he kind of just moved the rod around, and looking on the screen he can see where our eggs are.
He's checking our ovaries.
Yeah,
it was really easy and simple.
For him,
it was just
for him. For us it just looked like a black and white blur, but for him,
the process for us was very easy and simple. We just laid there for about 5 to 10 minutes. It wasn't like some scary process. A fertility MOT is so easy,
literally. And for mine, he could see the main egg that was the one that was ready, the strongest out the bunch. Is that what you call it? And then around it, the ones that didn't quite make it. So I'm guessing those are the ones that would be taken to froze if I was to do egg freezing.
Exactly.
Yeah. And he counted 8 for me, which was lower than average.
For your age.
For my age. And for you,
I had 11, which was lower than average for my age. So, I had high expectations, but they didn't deliver, which is good to know.
It's good to know.
It's very good to know.
Yeah, it's good to know. And technically he was like, you're basically Anna. Mandy's Anna, you're a year and a half ago.
Yeah.
So,
but now I'm going to freeze my eggs. And if I knew, I would have frozen them when I was, 20. So I would have had 20-year-old eggs. I would have. I swear to God.
Why not?
So then I'm not in this situation now, worrying, should I freeze them? Should I not? I would have done it earlier.
Yeah. And on that point, we do sort of say to women, ideally probably wait until you're about 25. So ideally,
don't listen to me.
Somewhere between 25 to sort of early 30s is ideal, because that's where your egg quality is going to be better.
It's good for me. I made that joke. If 25 to 30, guys, okay? Yeah, I would have done it earlier.
Yeah. So, and 25, if someone's younger than 25, I would probably say, let's just wait a little bit and then you can come back in a couple of years. But, it is something that definitely is, we know now, to be a really reliable option. And it's not a guarantee. Nothing is a guarantee with egg freezing. And we have to be clear about that and say, this is, I guess, an additional option that you would have.
It's like a backup.
Well, yes, in a sense. And I guess some people will use their eggs, some might not. Some might freeze eggs and then they might fall pregnant naturally and complete their family and not need their eggs. Some women, which we commonly actually are seeing now, is that they might fall pregnant naturally for their first baby, but then when they're looking to have their next baby, they might be in their late 30s or early 40s and they might have started trying again and not conceived, and so they go through and use their eggs then. So it's really personalised based on, what your plans are and how many children you think you'd like to have. And but it is an option.
I just want to do it ASAP.
Me too.
I'm
I feel like
ready.
if you'd done it earlier, you would have had less cycles because you would have more reserve eggs.
I just want to do it. It's just obviously it's so expensive. It's so expensive. But other than that,
we don't actually know how much it is. We need to find out.
We need to find out the exact price, but I've heard it.
We've heard horror stories about how expensive it is, but we're probably not. There's I'm sure there's payment plans.
Okay.
Stop bursting my bubble.
So there's options, and that's, and people can contact our inquiries team and they can take them through what those options are.
Price. On your egg.
On your baby.
Oh, yeah, exactly.
Yeah. No, don't sleep on your eggs because your eggs will start sleeping on you.
Yeah. Thank you so much, Doctor, for coming on this podcast.
Thank you so much.
So you really enjoyed it, learned so much. I hope everyone's learned so much as well.
Yeah, it's been very informative. Thank you so much.
And look how graceful.
Thank you so much for having me.
Very proper lady.
Very demure.
Very mindful.
Demure, yeah.
Very mindful.
And then there's me.
We're trying to be Gen Zs, but we're really not.
I know, yeah.
You guys are too kind.
Thank you so
Thank you for
much.
having
Thank
me.
you.
Thank you so much.
Thank you.
Guys, make sure you subscribe to our Patreon for an extra episode every Thursday where we talk and cry about our eggs on there.
Yeah.
Before we say bye, don't forget that London Women's Clinic is offering a whole fertility MOT at a discounted price of $450 if you mention our podcast, Sisters in the City. We love you.
Love you. Bye-bye.